technology that was introduced by Classis, and I welcome as a speaker Dr. Matteo Clementoni. He's a plastic surgeon at Hospital della Medical Center in Milano, Italy, in Milan, and he's a member of ASLMS, ASLAS, ESLD, and a very well-known international speaker, active in laser treatment, has done a lot of papers and great studies. So, Matteo, good friend, you will tell us about how to treat the laxity. Thank you.
Thank you so much. Thank you so much for the great introduction. I'm very happy to be here. I'm not able to stay fixed in one point for half an hour. So I'm sorry, I will walk. So if some one of you will have a headache at the end, it's my due. I decided to prepare this talk thinking about beginners and thinking about users, because I do not know which kind of audience I can find. So it's much better for me to try to explain you what I say to my patients, and that is for beginners, how the device is working, and which things on how we can avoid adverse events that I think is very important. And at the end, I will show you some of my cases. So, okay, sorry. I probably must here. These are my disclosures. I'm a consultant of different companies. This is a boring part, so give me 30 seconds. But we know that with aging process, we have the ptosis of all soft tissues and we have bone reabsorption. Can we do something on the bone? Not with this device. So probably the idea to take care of the muscles and in general of soft tissues with microfocus ultrasounds was a very good idea in my opinion. And why? Are patients understanding this? In Europe, unfortunately, we do not have any kind of statistics. In US, every year in February, the ASAPs publish the statistic regarding the previous year. And if you look there, we can they demonstrated that during the last year, the surgical procedure remained stable, more or less the same, while the non-surgical approaching to the lower 1/3 of the face or 2/3 of the face and the neck increased a lot. And they demonstrated that the total number of procedures year by year as a percentage increased. So this year the percentage is higher than the previous one, and the previous one was higher than the other one, and the expenditure as well is increasing year by year to year. Variation is increasing. So at the beginning is a new thing, but if the device is working, the number of procedures and the expenditure increase year to year. So my final analysis on that data is that the demand on skin tightening is absolutely growing. The request for surgical approach is stable. If a patient needs a facelift, please, that patient has to do a facelift. But the request for non-surgical approach, as the doctor told before, is increasing in double digit. So there is a great attention by our patient about a non-surgical approach on skin tightening. So I'm a laser operator. I started to use laser 25 years ago. That means that I'm old, but all lasers are devices that are working outside in. We are affecting the surface. We are passing through the epithelium with all lasers. With this, as the Walt Disney in Inside Out, with these devices and also with microneedling radio frequency, but also with microfocus ultrasound, the device is working inside out. So it doesn't matter, for example, the color of the skin. It doesn't matter if a patient is tanned or not, because we are going deeper. And from that point, we are coming out. And that is a very nice thing, because we can treat patients, for example, also at the end of July, just before summer. and that increased the number of our patients in our offices. So it's a complete different way to approach the tightening of the face. My patients started a couple of years ago to directly ask this kind of procedure. They were seated in front of me and they asked me, "Doctor, I want a non-surgical facelift." What that means, madam? That simply means the procedure that can tighten the skin up and so on. So they are directly asking for this procedure. They do not wait my suggestion, they directly ask that to me. And how I try to explain to them why this device is working. So I told them, or I described them a story when at 10 years old, I was at school and I tried to burn a paper with a magnification lens. If you put that paper on the sun for 1 day, 2 days, 3 days, no one will be able to burn that paper. But if you are focusing the energy in a single point, you are able to burn that paper. And this is the same concept we are using with the microfocus ultrasounds. So we are focusing ultrasounds. Okay, I told to my patients, have you done an echography before? That is the same thing. The rays are running parallel each other. The rays arrive to the organ and then come back, and the device is able to design what is the liver, what is the kidney, and so on. Well, with the microfocus ultrasound, we are focusing the energy in one point. So when we pass through the skin, all of them are passing from a different point, but we are focusing the energy there. And we can design the depth. We can move from 1.5 to 2 millimeters, to 3 millimeters, to 4.5 millimeters, to 6 millimeters, to 9 millimeters, and to 13 millimeters now, with the same device. Naturally, we are not affecting fascia or skin with the 13 millimeters. We are affecting fat. That is another way to try to kill fat cells. It's not my topic. But if you are thinking about 1.5, 2, 3, and 4.5 millimeters, we are affecting the soft tissue of the lower two-thirds of the face and the neck. We have to think that we can treat, for example, with the 4.5 millimeters, the muscle, or better, the fascia of the muscle. This is a movie showing you that the platysma muscle and the mass muscle over there, they are one single layer. So it's a single muscle that we are calling in a different way, but that is a single muscle. Look. So when we go deep and we affect the fascia of this muscle, we are trying to tighten all the area. So I suggest to my patients always to do the procedure on the lower two-thirds of the face and also the neck, or not only the neck but also the face. We are trying to tighten the whole area. If you are doing more than 2,500 microshots, we will have better results than doing only 500. So why not to affect always the lower two-thirds of the face and the neck? With the three different depth, with the three different transducers, we can affect the fascia of the muscle, we can affect the septa that are moving from the muscle to the skin, and we can affect directly the skin. And to be honest with you, I think that my 1.5 millimeters handpiece is still there, you know. Probably I use it only for 3 to 4 times because I love the 4.5 and the 3 millimeters. So we are affecting the fascia of the muscle, we are affecting the septa, and we have an immediate tightening effect of there. But because we are creating a damage, we are also stimulating new collagen production. So the final results of the patient is not 1 hour after, is not 1 week after, but is months later. Because we have the tightening effect and we have the collagen production effect. And as you know, probably much better than me, to have new collagen production, we need months. So that's why I suggest my patients to wait months. I put the comma there for the eyebrows and for the décolleté because probably Gerd Goglitz from Munich later on will explain you his own experience with the 2 millimeters handpiece, and also because we can do something else. We can do something else. We can do botulinum toxin from the eyebrows. We can do IPL. We can do laser-assisted drug delivery on the décolleté. We can do what we want there. But for the submental and neck laxity and for the lower two-thirds of the face, I think that this is the procedure to do. So naturally, we have not to go where the thyroid gland is. We have to avoid the hyoid cartilage and the trachea. We have, if we can, to avoid the major vessels. And if you are treating the décolleté, you have not to go to the breast tissue, but theoretically, in a normal woman, it's very difficult with 4.5 millimeters arriving to the breast gland. So this is only because we have to say that. And on the other things, I think that we have to avoid patients with severe systemic disease, and I do not do the procedure on them, or patients who are taking anticoagulants, because we are sure that in 2,500 microbeams, probably one small vessel, we will affect one small vessel, and I do not want to have any kind of hematoma over there. My approach to the treatments or to patients is that I tell them that they need 1 to 2 sessions depending on the skin problem. The interval between these 2 sessions is at least a few months, not 1 week and not 1 month. That the procedure is performed without anesthesia. We cannot inject anything, otherwise we are increasing the volume, and this is not good for the procedure, but it's painful. It is. They can say what they want, but it's painful. So what I'm suggesting my patients is, please take 1 gram of paracetamol before, and if you are taking them to sleep, you can also take some benzodiazepine, and so you are more relaxed, and we can take some painkiller just 1 hour before the procedure. They will have some swelling for a few days. They will have some redness only for a few minutes, so it doesn't matter. And again, they applying or putting the tip of their fingers on the face, they can have an unpleasant feeling for 1 week to 10 days after the procedure. So the most important thing to avoid, and then I will show you cases that don't want to bore you, is where we have not to go. We have to avoid some nerves. We cannot, there are not so important big vessels there that we can affect, but there are 2 nerves that we have to avoid, and then that can create us some problems. So, this is me, okay? A lot of fat there, so doctor, can you do something on me there? Okay, well, these are the 2 nerves that we have to avoid. This is much better. We have to avoid the anterior part of the buccal nerve, and more important, the marginal nerve. That's 2 areas. We have to avoid that. And that 2 nerves are at risk. So this is what can happen if we affect a marginal nerve. Why this can happen? Naturally, if you are not using a Class device. If you are buying a very cheap HIFU device coming from the east part of the world, look here. The emission of the micro sounds are not so precise, and so look how length is there, and so we can affect the nerve. But the most simple things is, please, put 1 finger close to the oral commissure and stay lateral. Theoretically, 1.5 centimeter lateral, 1.5 centimeter down, that is the point of the marginal nerve. There are some variation, so that area, don't go there. And then there's another tip that I have to you. This is trying to mark where the oral nerve is coming out. So I think that this one is much better to show you. So take the oral commissure, take the mastoid bone, and take a line. Then divide the mandible in 3 parts, and from the oral commissure, take a line going down to the sternocleidomastoidal muscle. This area is the area where we can have the buccal nerve. Can we realize where the nerve is? No, we can't. But if you are doing one shot, the patient will have a lot of pain. Don't go there anymore. It never happened to me. Theoretically, it's very deep. It's under the parotid before, so we cannot arrive to that. But in the arterial part, we can. So if the patient has pain there, move somewhere else. And these are the 2 areas we have to take care. There are only 6 cases reported in the literature of the nerve damage, not with this device. This is for culture. These are the 2 papers that are publishing these defects. But look, this is probably the reason. If you are using a very cheap device, come on, HIFU is HIFU. Why do you have to buy a Classis one instead of a Chinese one that is cost 5,000 euros? Why? Because if the emission of the energy is not so precise, we have a higher risk or much higher risk of having a nerve damage. So some other tips. Please use a fluid gel. These are for users. And I need 2 hands. Can you hear me? Okay. If you use a solid gel and you apply a solid gel on the skin and you put the handpiece on, the skin can do a thing like this. And so your target is not there but is far. So use a fluid gel. And if you don't have a fluid gel, I'll add some water. That is absolutely enough. And finally, don't incline at 180 degrees the handpiece. Don't do the procedure this way, because there's some water inside that is allowing the perfect emission of the energy. So the patient has to turn on one side on the other, and the procedure must be done in this way and not from the bottom to the up. Are you following me? Okay. So I followed the lines. I was speaking with Gerd before, and I defined that as a boring procedure. When you mark the patient and you apply the gel, is back and forth, up and down, back and forth, up and down. You can speak with the patient for the so-called talk anesthesia, but the results are great. So I have a series of cases. So also when some indications are not correct, where these patients, for example, I think deserve a facelift or a surgical approach, but she didn't want. And the results is great in my opinion. There's some more skin laxity over there, more soft tissue laxity over there, but the result is great and the patient was happy. Another one with a less severe ptosis, but the result is great again. Another patient. No problem also with her. I have tons of this. Look at that patient. I think that that is absolutely a surgical patient. It's a patient who has to do a surgical lift. Look at that area. But again, she didn't want. So we were not so able to fix that areas, but look at the neck. So going faster, is that working? If I ask you, okay, how much that patient has improved? 30%, elevate the arm. 40%, 50%, this is a visual analog scale and has no sense in a scientific talk. So what we did is to calculate angles. We calculate the angles from the glabella to the chin, and so we had 2 kinds of angles to calculate, the Newton angle and the cervicomental angle, and we compare the pre and post to understand if we were able to obtain a tightening effect. So that's the results, and the Gaussian distribution of the results demonstrate to you that this is a normal population. I cannot say you that I had an improvement in 80% of my patients of an incredible results. This is a classical distribution of the population with a median here that was great, with an average improvement of the cervical-mental angle of 27 degrees and of the Newton angle of 16 degrees. And that was great results in my opinion. And again, younger patients, the color can show you how the results improved. So again, on older patients, look at the color so we can demonstrate how that device worked on that patient. So maybe here it's clear, okay? So, and another patients, again, for that study where we demonstrated the effectiveness. So I think that I am at the end of my talk. I'm 27 minutes speech. So these are only 2 points where we marked where the patient had some non-absorbable fillers. And that's why I decided not to go there. I do not want to have any kind of adverse events because of other doctors injected her. So if you have non-absorbable fillers on the face of a patient, please don't go there. So to conclude, I think that I received a question very interesting before saying when to use HIFU and when to use microneedling radiofrequency. Well, I think that for all soft tissue ptosis, HIFU is much better. When you have only skin laxity, probably microneedling radiofrequency is better. But the majority of my patients at the moment are doing HIFU first and eventually microneedling radiofrequency after. Thank you very much for your attention.